In this short video, you will learn how to use the clinical reasoning tool and how it can help you to develop clinical reasoning skills. With the tool, you can document findings, symptoms, or risk factors of a patient. You can formulate differential diagnosis. You can enter tests and examinations that are necessary to confirm or rule out your diagnosis. You can choose management options, and you can formulate a short summary statement about the patient. Here you can see the clinical reasoning tool in a virtual patient in the learning system Casus. To enter a finding for your patient, just click into the appropriate field and then type in your finding, in this case, for example, fever, and then you just select it from the list. The same way you can enter a differential diagnosis. Just click into the field and then type in, for example, respiratory tract infection. And this might be a good working diagnosis at the moment. And so on. Like in a concept map, you can connect elements with each other to make relations visible. In order to draw a connection, simply click on the gray area and drag your connection to the target element. You can then edit or delete a connection by clicking on it. If you want to enter something that is not in the list, you have always the possibility to choose Add Own Entry. But please be aware that the system cannot automatically compare such manual entries with the author's entries. At any time, you can compare your answers with the author's map by clicking on the Switch button up here. But please keep in mind that there's no single correct answer in clinical reasoning. The pathways to a diagnosis can be very individual and depend, for example, on the clinician's experience. Please also be aware that for active and effective learning, you should always try to build your own map before checking what the authors thought. The other switch is for hiding or showing connections. At any time in the virtual patient scenario, you can make a diagnosis. Simply click on that button, then select one or more of your differential diagnoses, and then indicate how confident you are with this decision. And then click on Make Diagnosis. You then get a feedback, and in this case, we have chosen the correct diagnosis.